I still have the cough, have the headache, and kind of weak.
For the past 2 weeks, Shellie Mitchell has battled an invisible enemy. It might appear she's losing, but this 67-year-old doesn't rely on what the eyes can see.
So I'm coming back. I'm feeling better.
You hope that, or you know that?
I know that. I couldn't walk from my den to my upstairs without being on oxygen. So yes, I'm coming back.
She wasn't able to get a test, but is convinced her body aches and ever-present cough are sure signs of COVID-19.
My husband, he was tested, and then my sister, she's proved positive.
Her husband of 41 years, Tommy, hospitalized in the ICU for days, COVID-19 positive and fighting for his life.
So it was scary. It was scary. I prayed every day for him to come home.
As the coronavirus continues its deadly march, there's a grim reality emerging. Disproportionate toll being paid in Black and brown lives.
Sometimes when you're in the middle of a crisis, like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society.
While Black Americans make up just over 13% of the U.S., CDC data shows that they were 33% of the reported coronavirus hospitalizations last month. Among those patients, many who struggle with prior health conditions.
When all this is over, there will still be health disparities, which we really do need to address in the African American community.
Only a few states are tracking the racial breakdown of COVID-19 fatalities. But if history is our teacher, the most vulnerable will continue to bear the brunt of this virus's deadly strike. From Detroit to Milwaukee, New Orleans to Chicago. Detroit, the Motor City, the birthplace of Motown. Once a bastion of manufacturing, a city on its way to a comeback. At least until the coronavirus struck.
Currently in the state of Michigan, we understand that 33% of the COVID cases are African American. 40% of the deaths are African American, but yet African Americans only make up 14% of Michigan's population. So those numbers are striking.
Dr. Kimberly Farrow is the CEO of Central City Integrated Health in Midtown Detroit. Her clinic serves a mostly African American population. Many receive Medicaid, some are uninsured.
Before we were dealing with COVID, we were dealing with the war on obesity and heart disease and hypertension, because we recognize that these populations are vulnerable, more vulnerable to these maladies. And when you superimpose COVID onto that, our patients have an increased risk of having poor outcomes, poor health outcomes.
To make things worse, the clinic had to stop seeing most patients in person after running out of PPE. She adds it's hard for her patients to even know if they have the disease.
Testing sites, testing opportunities are very limited in inner city communities. Most of these testing opportunities are in suburban areas. Our patients already struggle with transportation, and so you have to either take a bus, find a ride to these testing areas, or walk, and that's just not realistic for our patients.
Michigan's Governor Gretchen Whitmer announcing today that she's creating a task force to examine the state's racial disparities.
Hey y'all, how y'all doing? Everybody staying safe? Too bad we can't shake hands, but we do it like this.
Right.
On the west side of Chicago, Reverend Marshall Hatch now delivering a message of caution.
When do you guys do service?
Nobody can do service now.
Really?
Because of COVID.
Over the decades, these streets have seen more than its fair share of challenges.
We're in a community now that has been disinvested in. We are segregated from opportunity and resource, and then we are become open season when this kind of pandemic sweeps across the country.
Roughly 70% of COVID-19 fatalities in Chicago have been among its Black residents, who make up just 30% of the city's population. The number is so alarming, Mayor Lori Lightfoot announced an outreach plan, including an awareness campaign and wellness checks for the most vulnerable. For Reverend Hatch, the pandemic came through his own doors when, on Sunday, it took the life of his sister.
She was the first in our family to go away to college. She was a public school teacher for 23 years, and she was really the matriarch of our family. My best friend, Larry Harris, passed away as well. He and I were friends for 45 years. And so it's really been a double blow for me personally.
As someone who was also raised in church, right, where our folk like to touch and lay hands on each other, and if COVID-19, you can't do that, so how are you supposed to mourn?
This is about as foreign of a feeling as I've ever had. You know, we're used to being able to go in a church, to find hope, and to have that taken away in the midst of this pandemic. It is incredibly, incredibly frustrating and adds to the pain deeply.
In Milwaukee, Wisconsin, the death toll continues to climb. And of those, 66% have been in the African-American community, while blacks only make up more than a third of the city's population.
You cannot get away from the fact that there has been intentionality in ensuring that minorities have been marginalized in this country for years.
Fred Royal is the president of the local NAACP chapter in Milwaukee. He says his brothers and sisters are dying, yet authorities are doing little to help.
None of the resources that they are targeting are being targeted in the central area with the highest rate of incident of COVID-19 is occurring.
How do you explain that?
Systemic racism. We've always talked about, we understand where the need is, but we don't invest the resources there. So what else can you attribute it to?
Our decision to include race and ethnicity as a measure of our COVID incidents was very important. It was rooted to that declaration of racism as a public health issue.
Dr. Jeanette Kowalik is the health commissioner for the city of Milwaukee. She says combating the virus starts with being transparent about who is the victim here.
If the data on race and ethnicity was more available since the beginning of this outbreak nationally, I think that could have helped us provide a more robust campaign.
The virus has taken more than 700 lives in Louisiana, with African Americans accounting for more than 70% of those deaths. In hard-hit New Orleans, the music that once celebrated life and death, now on pause.
The grieving process is on hold and just waiting on the right time to properly grieve.
Elroy James is president of the Zuly Club, a black cultural organization known for its lavish carnival parades. Weeks after Mardi Gras, the pandemic devastated his club.
Many more members were hospitalized on ventilators. We started experiencing deaths within the membership within the last 2 weeks.
Among the lives taken, youth mentor Cornell Charles and Zulu King Larry Hammond.
A great friend of mine and was certainly would be missed.
Founded in 1916 to provide free burials for the black community, the Zuly Club now grieving from a distance.
We're going to have to, again, figure out a way to celebrate the lives of our brothers.
The earth has no sorrow that heaven cannot heal.
Back in Chicago, words of faith still streaming out through turbulent times. The pews empty to keep the congregation safe. The Reverend offering comfort and hope online.
We're going through this during the Passover season. It was a similar kind of situation where people were told to stay in the house, to shelter in the home until the plague has passed over. But the good news is this too will pass.
As a sister used to say in my childhood church, make it plain, preacher.
The pandemic of 2020 is something we'll always remember. You know, for families like mine, we'll remember the people who were lost. Weeping endures for the night, but joy will come in the morning.
Never lose its power.
For Shellie and Tommy Mitchell, that joy came this morning. So they tell me, word on the street is, there was good news today.
Yes, it was. My husband came home today. I have my partner, I have my husband, I have my lover, and he's home, and he's doing good.
What was that moment like when you got out of the hospital today?
What you think? You know the answer. I got me a hug.
When you were in the hospital, when you were in intensive care, were you scared?
Yeah.
Tonight, together again. Their love enduring, their laughs plentiful. For them, it's as much a remedy as anything they received at the hospital.
We take care of each other. It's back to the old school.
Yes, sir. The young folk will call that ride or die. That's your family.
Well, I don't know what y'all call it, but I know what I call it. I call it love.
Love is a powerful medicine.
Yes, it is. And it can cure a lot of things.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.